All right, let's talk foot function because every client that comes in through my office does not have a clear understanding of this topic. Just like the earth needs to rotate on a certain axis to keep going, so does your feet. So gait step is often important in how we walk with foot and ankle strength. The key is we want a strong and balanced foundation with the ability to still use our toes. Your foot should be a stable tripod, and our feet are designed for stability and mobility. Think about caveman times. And as time evolved, unfortunately, shoes were created for fashion and not function. So shin splints. Now it's almost that time of year. Flip-flops. These are flat and they don't bend exactly how your foot does when we walk. This alters the biomechanics and affects your posture because our feet are naturally pronated during a gait cycle. So when we wear flip-flops, we pronate and we use the first and second toe, which can also cause shin splints, causing you to work your muscle harder and then activate the plantar fasciitis problems and the tibiofibular joint injury that travels into the knee and up into the hip. So when a tibiofibular joint is injured over time, weakness is poor gait step that takes place, putting on stress on the ankle, and then the plantar is flexed, and this causes proximal fibular. So also thick soles and inserts. Unfortunately, sometimes we may think that these are a help, and most doctors even recommend them, but actually they do a disservice to your foot. This will confuse your brain and where the earth really is. It is a negative chain reaction, and it screws up the whole axis of the body. So including high heels, these cram your foot into an uncomfortable toe space. They cause corns and hammerhead toe. They also cause tight calves. They shift your pelvis forward to cause pelvic floor dumping and lower back issues. This can cause a habit on the sublux, which is a partial dislocation over the lateral part of the knee joint, and the knee or the hip issues over time it happens, and when we think something's wrong, we think knee surgery, when really it's a gait chain reaction that has happened over time with improper foot function. So I can go on and on about the subject, and there's much more to discuss, but I'll stop there. The bottom line is it's all connected. So try to spend more time barefoot and be aware of your precise gait step and how you move those little piggies to communicate with the earth below you.